Hi, thanks for joining us today. I'm Donna McMullen, your host from BRMC. Joining me today is Dr. Paul Nice, and I'd like to give the viewers a little bit of background about Dr. Nice. Please help me with this word. I know that I'm going to stumble over it. You are a board certified
otolaryngologist.
Oh, see, ladies and gentlemen, this is and you do head and neck surgery. And you've been here in Mountain Home since 1988?
Well, 1991.
1991,
I finished my training in 88, but I was elsewhere for 3 years.
Okay, then came to Mountain Home.
Yes.
All right. And also I know that your board, you have a second board certification in sleep medicine.
Yes.
And also in doing some research, know that you're in North Central Arkansas, the only board certified sleep medicine professional.
Yeah, currently so.
Certainly
yes.
so. Because you're medical director over at our BRMC Sleep Lab, and we're going to talk a little bit more about that today. You've practiced, as you said, since 1991 here in Mountain Home, and your children all grown now, and
they went through the Mountain Home schools,
yeah.
which is a wonderful system.
Yeah. And now your son he's finished medical school.
Yes, and actually he's in a residency program in my same specialty.
Same specialty,
ear, nose, and throat.
Following Dad's footsteps here.
Yes.
Probably thinks he knows more than Dad maybe right
Sometimes
now.
he probably does.
Okay. And so he's going to have to go through 5 more years.
Yes.
We were talking earlier too, what does it take to become an eye, throat, and nose specialist?
Not eyes.
Or never, that's my ear, nose, and throat. I knew I would do that today.
Yeah, that's okay, a lot of people do.
That's certainly telling my age, because once upon a time when I was little, they were all joined together, weren't they?
They used to be. But what it takes is, first is 4 years of college, and after your bachelor's degree, then there are 4 years of medical school. And the ear, nose, and throat head and neck surgery residency is 5 years.
My goodness.
And then, of course, to get my sleep board certifications took a lot of continuing education in the last few years.
So working all day and studying all night.
Studying in the evenings,
Oh
yes.
boy, what dedication. And I know that all of your patients certainly appreciate that. And we certainly do. We appreciate you very much over at the hospital.
Well, thank you.
Now you have a daughter also, and what is she doing?
She is in veterinary school,
Oh,
and she will be finishing up in May of 2011.
Oh, that's great. Will she head back this way, do you think? And
well, that eventually we'll see.
yeah, well, one
that
of those
will be up to her.
Okay. Well, we've got a lot to cover today. I want to be sure, and I've got so many questions for you so that we can share this with our viewers so they have a better understanding about what you do. You've gone to school for all of these specialties. Let's find out what they are. So what areas of care are covered by a doctor with your specialty?
Well, we cover a wide range of different types of surgery and medical care in the head and neck. And that's actually one of the, if I'd say a problem that we have with public relations is a lot of people don't know what all we do. Mm-hmm. Most people know the usual things that we would do, taking care of children with tubes in the ears, tonsils, taking care of sinus problems, throat problems in adults. But many of the things we do, people don't realize. We are the head and neck cancer surgeons, and we do treatment of that, including thyroid problems.
I had no idea of that.
As part of head and neck cancer, we do skin cancer because that is one of the cancers of the head and neck. Intertwined with the treatment of skin cancer of the head and neck is another area that we do that many people don't realize, that we do facial plastic surgery and reconstructive surgery. So certainly we do reconstruction for trauma, reconstruction after removal of skin cancers. In our practice here locally, don't put a lot of emphasis on the pure cosmetic area of our facial plastics. We're trained in that.
Sure.
But we just decided not to pursue that because we felt that we were busy enough doing more purely medical problems than doing things like facelifts. Although we do some purely cosmetic work. If someone comes in and their nose is not working to breathe through, but they want it to look better, we will do rhinoplasties. We will do blepharoplasties on people who have excessive skin of the upper eyelids, which is common
Sure.
in the older population around here. But purely cosmetic has not been our emphasis.
Nope.
Another thing that people don't realize we do is allergy. We do testing and shots because allergy is a very important part of the
Especially
treatment
in-
of the sinuses.
Sure. Oh, okay.
So-
Especially this part of the world, I'm sure that.
Well,
yeah.
yes,
Yeah.
definitely in this area. But if you have problems with chronic sinus disease, a very high percentage of those people will be related to allergies. So if we were not addressing that, we wouldn't be giving full care. So we feel that, you know, for most of those types of problems in the head and neck, we're kind of the one-stop area that we cover all of that.
All of that, yeah. That would be something, because most people would think of skin cancer, that you'd automatically have to go to a dermatologist.
And, you know, certainly dermatologists
Sure.
treat that. In many areas of medicine, there are overlaps
Sure.
of one specialty will do something and another specialty will also do it. But, you know, I personally have a prejudice thinking that we are the best people trained for skin cancer of the head and neck, because we're not only the cancer surgeons who understand the complete removal of that, we can do things like sentinel node biopsies for melanoma of the head and neck, which the dermatologists will not be doing that, and we can do our own reconstruction. But not only that, many cancers can spread to lymph nodes. Once again, certainly dermatologists are not trained to treat spread to lymph nodes in the areas of the face and the neck.
I'm glad we're doing this today, because I know this is helpful to our public. This is something that I certainly had no idea, that the scope and the depth of what you do within your practice. So this is wonderful to be able to educate everyone and get the word out about all of the services that you provide in your
Well,
practice.
and we have many people who've come and seen us in the office for other things, and then find out after the fact, oh, you also do that. And, you know, one of the things about medicine is I'm still rather old-fashioned about advertising. And certainly people are seeing more advertising done in medicine. But if you don't put a billboard up and say, we do this, a lot of people just won't know it.
Just don't know it, right?
Yeah.
And it is. It's a. I've seen, due to my age and being in marketing and advertising all these years, certainly a change from there was a time when you would never ever see a physician advertising their services, and that's certainly come full circle. And now it's just the nature of the beast, so to speak, that sometimes people have to. But this is a wonderful way to get the word out, as I say. So,
Good.
a couple more questions for you. We talked about the skin cancer, and can you treat the deeply invading skin cancers and ones that reoccur after they've been removed?
Yes, and as a matter of fact, that's again one reason I think we are particularly able to handle the full range of the skin cancers, is because we're operating on other aspects of the head and neck all the time. We operate on the parotid saliva gland in the face, which has the nerves that go to the muscles of the face running through it. We're operating on the neck with the nerves and the blood vessels involved there. So if something is going very deep, we're intimately familiar with that anatomy.
Okay.
Whereas if you have somebody who hasn't been trained in head and neck surgery, these are the cases that I tend to find in the long run end up down the road coming to me with a recurrence, is because people get afraid, oh, I don't want to go that deep, I don't know what's under there. Or the other thing is they start getting scared because they see how big the hole is that they're getting. And so then they stop.
And they're not trained for the reconstructive, so.
Correct. So if you're trained as a cancer surgeon, the first thing you do is say, I'm going to get all that cancer out, then I'm going to decide what to do to reconstruct it. But people who aren't trained in both aspects tend to sometimes stop a little short of what they should, and more likely to get a recurrence.
Okay.
There is a type of surgery for skin cancer called Mohs surgery. That again, if you talk about advertising, Mohs is kind of a marketing thing. And yes, it's a good way to take out skin cancers, but it's not the only way to have a very high cure rate of removing skin cancers. So,
Kind
you know,
of a buzzword for
Yes.
your particular specialty area. So,
Yeah, so it's a buzzword that's done only by certain dermatologists, usually in the big cities. And some people think, oh, I have to go get Mohs surgery, but we do techniques that have really an equivalent cure rate. And what we do is we take out separate margins, get frozen sections by our pathologists, not doing things by the old way of just take out the whole piece and send it and do one cut and see if you've got it all. So I think we can really come equal to the results of that.
There's an awful lot of, we've had a conversation before with, there's an awful lot of technology that's available to all sorts of physicians and their specialties, that it's not necessarily that the equipment or the technology is so much better, but the public's perception is that this new technology makes the technique better. And in some cases, I know that physicians have disagreed with that in its entirety, saying, no, we can do that. We don't need some of the newer equipment.
Well, in particular, you talk about advertising. There's equipment available, say, for a different technique of taking out tonsils. Is it any better? No, but the company can make a lot of money because they charge about $200 for each handpiece to take out the tonsil. We have an equivalent way of taking it out, but they've advertised heavily. Ladies' Home Journal, Parent Magazine, Today Show, and they have a website, and then people are sold on the advertising, oh, you have to use this particular thing. No. No. There's more than one way to skin a cat.
Let's pursue this further as soon as we come back. We're going to take a short break. Please don't go away. Come back and join us with Dr. Paul Nice. It's so wonderful to have you here today.
Thank you.